function is intact. So now we're going to go to resistance, up, down, abduction, adduction, bend that knee out, external rotation, internal rotation. Wonderful. Okay, so we had full range of motion with and without resistance with 5 out of 5 strength in both extremities. So now we're going to have you exactly just like that. We're going to now move on to your ankles. I'm going to have you dorsiflexion up, plantar flexion down, abduction out, adduction in, and then I'm going to have you invert, evert, yep, exactly. And then we're going to do resistance, dorsiflexion, plantar flexion, abduction, adduction. Beautiful. Okay, so also full range of motion with and without resistance and 5 out of 5 strength. So now I think it's time for you to sit up. Okay, so I'm going to have you the same thing. We're going to extend both legs out. Yep, and flex in. And then you're going to do to resistance. Yep, beautiful. Okay, so now we're going to move on to your C-spine. So I'm going to have you kind of just repeat after me. You're going to look down, look up, look right, look left, ear down to your shoulder, ear down to your shoulder. Great, so now we're going to do all of those to resistance. So forward, back, and then out, yep, exactly this way, down, down. Beautiful. So we had full range of motion with and without resistance, 5 out of 5 strength for C-spine. I'm going to have you shrug your shoulders. Yep, to resistance. Good. This tells me that cranial nerve 11 is intact. Now we're going to do range of motion, but in your arms. I'm going to have you kind of repeat after me here. You're going to go flexion up, extension down. Yep. And then we're going to abduct out, adduct in. And now we're going to go this way, and we're going to invert, evert, bicep flexion, bicep extension. So now we are going to do all that to resistance. So up, down, out, in, arms at your side. Try to hug yourself. Other way. Give me resistance up and down. Perfect. So now you're going to have your hands out in front of you, and we're going to do a continued range of motion with your wrists. So you're going to go up, down. You're going to supinate, pronate. Now you're going to do ulnar inversion and radial inversion. Beautiful. So now we're going to do what we can to resistance. So we're going to do up, down. So you're going to do, you already did your supination, pronation. I'm going to have you invert, evert. Great. Okay, so now I'm going to move on to your fingers. So I'm going to have you abduct out, adduct in. Great. So abduct out to resistance, adduct in to resistance. Wonderful. Okay, so you had full range of motion, 5 out of 5 strength in all of your extremities. So that's a normal finding. And now we're going to move on to the neurologic portion of this exam. So to begin, I'm going to test your deep tendon reflexes. So I'm going to move on to your right side. And I'm just going to have you kind of give me your full body weight here. This is going to be testing your tricep. Great. Okay, so that is intact. Now we're going to test your bicep reflex. So you're going to just kind of lay that nice and flat. Great, so that's intact. Now your brachial radial reflex. Okay, intact. And now I'm going to move on to the other arm. Okay, so again, your tricep reflex. Great. And your bicep reflex. Okay, present. Your brachial radial reflex. Okay. And then I'm going to have you kind of scoot back so that you're kind of against, a little bit more forward so you're kind of against gravity here. Okay, we're going to do the best we can. So you get your knee reflex. Great. And then I'm going to hold the ball of your foot to test your Achilles reflex. Okay, intact. Now I'm going to test your Babinski, and I'm going to start at the lateral aspect of your foot. Great, okay, and go this way. Great, so your toes fanning in are a normal finding, so that would be a negative Babinski reflex. So now we're going to move on to the sensory portion of this exam. So what I'm going to do, I have two objects here. I'm going to have you close your eyes, and what I need you to do is tell me the location and whether it's a soft or sharp sensation. Okay, so now you close your eyes.
Hard left forehead. Hard right forehead. Soft right cheek. Soft left cheek. Hard left chin. Soft right chin. Hard left arm. Soft right arm. Soft left hand. Hard left forearm. Soft right forearm. Hard right hand. Hard left leg. Soft left knee. Soft right leg. Hard right knee. Soft left shin. Soft left foot. Hard right foot. Hard right shin.
Okay, so the patient is exhibiting normal sensation in all 6 domains. And now I am going to test your cerebellar function, or cerebellar. So what I'm going to have you do is I'm going to have you touch your knees and alternate with your knees and your hands kind of like this as fast as you can. Okay, good. Now I'm going to have you come up, and I want you to point your finger to your thumb and alternate all of your fingers like this. Yep, as much as you can. Quick, good, okay. Now I'm going to have you do just point your finger and thumb as fast as you can. Good, okay. So now I'm going to have you go out like this, close your eyes, take your pointed finger and alternate touching your nose with your different, yep, exactly. 2, 3, 4, okay, good. So that cerebellar function is intact. Now what I'm going to have you do is I'm going to put my pointer finger in different locations. You're going to touch your nose and then touch my finger, okay? Okay, cerebellar function is intact. So now I'm going to test your stagnosis, and so I'm going to have you open your hands. Yep. Close your hands. Close your eyes. I'm sorry. And I'm going to put 2 objects in your hand, and you're going to tell me what the objects are. So close the objects. Yep.
A battery and a coin.
Okay. So her stagnosis is intact, and now I'm going to test your gravesthesia. So I'm going to have you close your eyes, put your hands out in front of you. I'm going to write a letter in your palm. You're going to tell me what that letter is.
B.
Okay. Now I'm going to write a number in your palm.
4.
Okay. Wonderful. So that tells me the gravesthesia is intact, and that's all normal findings. So now I'm going to have you stand up, and I'm going to have you dorsiflex. So you're going to bend this way up, exactly touch your toes. Great. So I'm testing for scoliosis here. So spine has normal curvature, hips are even, and there's no bulging or masses noted. So I'm going to have you stand up, and so now we're going to do the Romberg test. I'm going to have you face the, yep, exactly. So I'd like you to close your eyes, and we're going to count to what would be 20 seconds. We're just going to do 1, 2 seconds for this video here. We see no swaying, which tells us that our Romberg test is negative. So now I'm going to have you do is I'm going to have you balance on one foot. Yep. 1, 2, 3, 4, 5. Other foot. 1, 2, 3, 4, 5. Wonderful. So you were able to do that, which tells me that your balance and proprioception is intact. So now I'm going to have you face this wall here, and I want you to walk heel to toe, 5 steps forward, 5 steps back. Okay, great. So again, telling us that your balance and proprioception is intact, and thank you for your participation in our video.
Thank you. And that's not too tight, is it?
Nope.
Flex your arm. Do you know what your normal blood pressure is? Just normal or?
I think just normal.
Okay, sweet. Okay, it was 132/78, so that's good. I'm gonna take this off of you. Next, I'm just gonna palpate your temporal and carotid arteries. So I'm just gonna make sure I can feel a pulse on both. Okay, and then for your carotid, I'm just gonna do one at a time. Another side. Okay, that was normal on all of them, so it's like 3+, so that's good. All right, next I'm gonna auscultate your carotid artery. Okay, I'm also gonna do one at a time, obviously. Okay, side. All right, that's good. I didn't hear any bruise, so that's good. All right. Next, I'm gonna palpate your jugular veins to make sure that nothing looks wrong with them, and yep, they aren't distended at all, so that's good. All right. Next, I will be doing just an inspection of your upper extremities, like your arms and everything, to make sure that nothing looks wrong with them. All right. Yep. Here. Okay, I don't see any masses or anything that could possibly be wrong with them. Next, I'm just gonna check your skin turgor on your arms. Just pinch it and see if it goes back to normal. It's good. It's less than 1.5 seconds, so looks good to me. And then your appearance of your upper extremities are pink and warm, and that's normal. Then I just need to check your capillary refills on your fingers. Make sure that they're less than 3 seconds. I'm just gonna do a few on each hand. Okay, good. It's less than 3 seconds. And then I'm going to now palpate your brachial arteries, which are in here, and your radial arteries. And I'm gonna do both at the same time so that I can make sure that they're both the same. Okay, that's good. I can feel them both. Okay, yep, I can feel them all. So now, since I can feel them all, I'm going to listen to all of them for a minute and get your rate for both of them. So I'm gonna start my watch. Maybe find it again. Okay. So I'm gonna do this for a full minute so I can make sure it's right. Okay. Okay, I got 67 on that time, so that's good. Okay. Normal is like 60 to 100, but since you're an athlete, I bet you it's lower than normal.
Okay.
Then I'm now going to inspect and palpate your lower extremities for like the skin turgor again, appearance, color, and I'm also going to be looking at your veins to see if you have any superficial veins, which I don't see any right now, but I'll have to check like behind your knee and stuff. Okay. So I'm going to check the skin turgor. Good. I'll do it down here too. Okay, it's good. Less than a minute.
Okay.
Or a second. Right. And then I don't feel any abnormalities, so that's good. And look behind your knees because that's where the skin is the thinnest for any superficial veins, which is normal if you do have some, but they look good.
Okay.
Okay, next I'm going to palpate your femoral, which is up there.
Okay.
Your popliteal, which is behind your knees.
Okay.
And then your posterior tibial, which is behind your ankles, and your your pedal also. Okay. So, and your legs look pink and warm and dry and normal hair distribution and all that. So that's good. All right, I'm going to now find your femoral pulse. Let's just see if it's there. Okay, good. All right, next I'm going to make sure I can feel this one. Okay, good. They're both normal on both sides. All right, and this one is down here. Okay, so the ankle brachial index is 1.03, which is normal, and your blood pressure for your ankle is 146/86. Okay, so next I'm going to move on to the cardiac assessment of this. I'm done with looking at your whole body. Now I'm just going to assess your heart. So I'm going to inspect your anterior chest wall for any heaves, retractions, or anything, but I don't see any of that. Okay, I'm just going to feel around and make sure everything feels normal. Okay, everything feels normal, normal contour. I don't see any pulsations or anything, so that's good. Now I'm going to palpate your apical pulse for the location of it. And then I'm also going to auscultate all of your heart sounds in 5 different points. Okay. I'm going to start with your aortic, I'm going to move to the pulmonic, Erb's point, tricuspid, and then all the way over here is your mitral.
Okay.
And last one. Okay. Sounds good. You have normal S1 and S2 sounds in every point.
I'm going to quickly dim the lights. And I am going to look at the pupillary response to light. So you just look straight over my shoulder. You can blink as you need to. And then I'm going to test the consensual response as well. Perfect. And I'm going to check the pupillary light reflex. And I can see that it is at about the 3 and 9 o'clock on both eyes. Well, I guess before I do that, I'm gonna have you cover your right eye, and then you're gonna look into my left eye. And and then I'm gonna close this eye. And then if you'll just let me know whenever you're able to see your hand.
I see it.
Perfect, my hand, not your hand. And that is the confrontation test. Next, I am going to take a look into your eyes. Normally I would do this bilaterally, but for the sake of time, I am going to just do one side. So I'll just have you look right past my shoulder. I'm gonna get a little bit close, and I'm gonna look in. Perfect, if you need to blink at any point in time, you can. So I'm able to visualize the macula, the optic disc, as well as the retinal nerves. I'm able to see that it's a yellowish orange color, and the retinal veins do not look distended at all. I'm going to turn this light back on. Next, I am going to go ahead and take a look in your mouth. Let me grab this stuff over here really quickly, actually. Just all of it. So just with her being able to talk, I'm able to already know that cranial nerve 9 is intact. I'm going to have you open your mouth up wide. Perfect. I'm just going to take a look. I'm going to look at the hard and soft palates, as well as the teeth and the buccal mucosa. The buccal mucosa is pink and is moist. Can you stick your tongue out for me? Perfect. Can you put it up towards the sky? Awesome. And then I'm going to have you say, ah. Open nice and wide. Perfect. And so that tests cranial nerves 9 and 10. And then the tongue movement also shows that cranial nerve 12 is functioning as well. I am going to have you raise your eyebrows for me. Perfect. Smile, frown, puff out your cheeks. Perfect. And then if you'll close your eyes and then open your eyes against resistance. Perfect. That tests cranial nerve 7. And then I'm going to feel your temporomandibular joint. If you'll open up wide and close, clench your teeth. Perfect. There's no clicking of that joint, and that also tests the motor function of cranial nerve 5. I'll have you close your eyes for me and let me know if you feel something sharp or soft.
Sharp. Soft. Sharp. Soft.
Perfect. And I would continue to do that over the entire face, and that shows the sensory function of cranial nerve 5. Next, I'm going to have you cover one of your nostrils. Take a deep breath in, and that shows patency of that nostril. You can relax. And then I will have you close your eyes and cover one nostril again. And tell me what you smell.
And I'll close.
Perfect. And that is the olfactory nerve, cranial nerve 1. Before moving on to your ears, I'm just going to go ahead and test cranial nerve 11. If you'll turn your head this way, and now the other way, and now pull your shoulders up. Perfect. So that's cranial nerve 11, the accessory nerve. Next, I'm going to go ahead and take a look in your ears. So I'm going to switch out to the otoscope. Do you have any ear pain?
No.
Perfect. I'm going to take a look in your right ear. So I'm going to start by inspecting the outer ear, look at the pinna, and I'm also going to palpate the tragus as well. I don't know any drainage. There are no lesions in the ear, external ear either. I am going to go ahead and turn on my light, make sure it's functioning, and I'm going to pull up and out. Let me know if you have any pain. Perfect. So I'm able to visualize that tympanic membrane. There is a little bit of cerumen. It is kind of a yellowish copper color. It's very minimal. And I'm able to see the light reflex in that anterior inferior quadrant of